Thank you for coming to our website. I'd like to introduce myself. My name is Dr. Burt Liebross. I'd like to tell you a little bit about my background. I started off in Chicago at Chicago Medical School and came out to Los Angeles, where I went to County USC and became a resident in internal medicine. Finishing that program, I went to UCLA, where I had some excellent training with some of the top people in kidney disease. Subsequent to that, I joined Valley Internal Medicine, where I've had a lot of different positions through the years. I've been Chief of Medicine at Valley Presbyterian Hospital. I've been head of the Ethics Committee at Valley Presbyterian Hospital. I've also been the director of the Osteoporosis Center over at Tarzana Medical Center, and for 2 years was the director of the Intensive Care Unit at Tarzana Regional Medical Center. These experiences have been excellent. I've also been head of the Utilization Review Committee for a managed care organization, which was fascinating because I once again delved into the different specialties and subspecialties of medicine so that I understood what are the best practices in dermatology, what are the best practices in ophthalmology, and basically was involved in reviewing these items with various physicians that were participants. Subsequently, I've been practicing medicine and nephrology and have enjoyed it greatly. I'd like to tell you a little bit about my philosophy in a moment. I've been blessed with a fantastic family. I've got a very supportive wife, 3 children, and 6 grandchildren, all girls, and that's been a tremendous asset and great value to the quality of my life. I've interspersed some hobbies, including golf, bicycle riding, yoga, and at the end of a busy day, I don't periodically mind stretching out, taking some deep breaths, and charging up for the next day. I consider myself to be a physician always trying to learn new approaches, and I'm fortunate to be blessed with an organization that is capable of really ascertaining diagnostically and therapeutically the elements of what we need to figure out on our patients. So in-house, if we needed, for example, an analysis of someone's bones, an ultrasound of their kidneys, assessment of their carotids, pulmonary function breathing tests, stress testing, we're actually able to do all of those things internally, and I find that to be fantastic from the point of view of quickly diagnosing and assessing people, stopping multiple referrals when they're not necessarily needed, and directing a person towards the proper direction. Lastly, I'm strongly interested, frankly, in psychology, and I think there are certain dynamics and certain periods in which the mind and the mood so strongly impact a person's health, both physically and mentally. So through careful study and working with very top people, I'm quite certain that we've been able to really help many people out who have also emotional needs outside of their physical. I thank you for listening to this lengthy discussion and certainly would welcome meeting you at some future date, and all the best to your health.